So, Dr. Mills, here's a Twitter question that reads, is the one-shot vaccine being tested on young children and adolescents, and is this in fact ethical?
And the answer to this is absolutely. We're going to test this in adolescents and young children. We'd like to test it all the way down to neonates. So we do this all the time. I mean, obviously, most vaccines are made to be given in childhood. And so we have a long history for decades of testing these in young people. The parents give the informed consent. Oftentimes, it's people who work in medicine who help to volunteer their children to participate in this because they know how important it is. So Moderna and Pfizer are already starting theirs. J&J is going to start their trials in adolescents 12 to 18 very soon. We're hoping that we're going to have a vaccine for children by September or October, hopefully when they start to go back to school.
All right, Dr. Mills, last question. This comes from Facebook and reads, should children be vaccinated before returning to school? This is a huge debate.
I think as soon as we find out that the vaccine is safe and effective in children, children should be vaccinated. Absolutely. I mean, we certainly know that children are at lower risk than adults, but we had 10,000 hospitalizations last year in the United States of children from COVID-19. And then we have this syndrome that we're seeing, a severe inflammatory syndrome that happens in kids. Even if they had no symptoms whatsoever from the COVID, they can actually die from this inflammatory syndrome. So I think it's very, very important that we work on developing this vaccine and we get those kids vaccinated as soon as we know it's safe and effective.
Well, and that being said, the safety factor, I mean, I don't think it would be safe until you reach at a minimum that herd immunity number. They say something like 70%, but...
And the kids are part of the herd immunity. Let's not forget that, right? Let's not forget that the children are part of our population.
Right. So what's your comment on that, Dr. Mills?
I mean, obviously, you know, we've had to tier the rollout because of a limited supply of vaccine. But as supply increases over the next couple of months, we're very excited about opening this up to everyone. So I think once we can get all the men vaccinated, all the teenagers vaccinated, all the healthy youth vaccinated, then we'll find out if it's safe and effective for children. We get the children vaccinated. As soon as we can roll it out like that, that's when we can achieve that herd immunity. And that's when we're really going to get to the other side of this pandemic.
Sounds good. Listen, thank you so much for your expertise and your great information, Dr. Mills. Keep up the good work.
What a pleasure. Thank you so much for having me. You guys have a great day.
Thank you. We've added links to the Men's Health Foundation on our website, thedoctorstv.com.